we have with us social worker Nancy Reeves, as well as two psychologists, Steve Boley and Dave Ja. And we say welcome to all of you and thank you for being here. So I'll start with Ms. Reeves. Please tell the audience a little bit about yourself and your area of expertise before we begin our discussion tonight.
Well, thank you very much, Daniel. As I said last week, I am a social worker. I have both my bachelor and master's degree in social work, specialization in gerontology, international social work, policy and administration. Of course, I've been a social work professor here in Canada for the last 12 years. Personally, I also work as a clinician, have seen a lot of clients on a daily basis with issues around mental health as a result of trauma and other situations. I also have my own private practice here in Ontario that are called the Global Education Counseling Services that I will be am working with clients with a lot of issues from depression to anxiety, couples to teens or children. I also provide anger management and co-parenting training as part of dealing with some of these situations. That's enough for now.
Well, thank you. And thank you so much for joining us.
Thank
We
you.
also have tonight Steve Bole as well with us, a psychologist. And at this time, can you please tell us about yourself, Mr. Bole?
He's on mute.
Mm,
Thank you. It is a pleasure being on here. Uh, I'd like to start off by saying the Liberian people are the most important people on earth, and that is a fact that cannot be debated. Um, I also like to remind the Liberian women that they are the most beautiful women on earth. Again, that's another fact that cannot be debated. Um, I like to say I live in Phoenix, Arizona. I am a doctoral candidate. Um, Most times in our Liberian setting, um, we don't like to identify ourselves as doctoral students or doctors until you are fully completed. From that day, you get that paperwork that say, "Hey, you can run with this title or this name." Then we do that. But in our Liberian setting, most of the time people just throw the title on you, and But I just want to put it out there for disclaimer that we have not completed yet. We are almost done, but we have not gotten the final okay and clearance from that yet. So we're working on it. I got a master's in professional counseling and psychology. Currently work as a clinician, doing different types of work from assessment to diagnosis and to different things. I work with different groups of people as well, different age groups, different population, different genders. I have a bachelor's in Christian studies. Uh, and I'm grateful to be here to share knowledge and to learn also from our viewers and our panelists. Thank you so much.
Thank you, Mr. Bole. And up next, we have Dave Ja, the brother of our founder, Dennis Ja. Welcome. Tell the audience a little bit about yourself.
Thank you, Danielle. Yes, the brother, older brother. That should be emphasized as well. But thank you for inviting me in here. As you said, my name is Dave Jal. I am a student of psychology, counseling psychology. I am not a psychologist yet. I'm a clinician. Um, I hold my associate. First, I started with biology in the Republic of Liberia, where I studied biology and chemistry with the intention of becoming a medical doctor. Then came the war. I fled to a number of West African countries where I resided as a refugee until to the United States in 2000. And then I decided to switch from medicine to psychology because I could not afford. I was a F1 student paying out of pocket, so I decided to take the at least a route that was financially feasible for me. So I got my associate from a community college in psychology. Then I went to Temple University where I obtained my bachelor's, and then to LaSalle where I got my master in clinical counseling. And I subsequently became licensed by the state of Pennsylvania, and I am a licensed clinician. I work in community health. I provide counseling services for a variety of clients, especially those at the very high end of the mental health trajectory. I work mainly with folks suffering from schizophrenia, bipolar, borderline personality disorder, PTSD, and a variety of, of challenges. Currently, I'm doing my doctoral studies at the Holy Family University, and I'm delighted to be here to share the little knowledge or the lack of knowledge that with my fellow Liberians. So thank you for inviting me.
Yes, you're always welcome. And thank you again to all of our guests. You all have made it very clear that you are well-versed, well-knowledgeable in this topic of mental health, specifically mental illnesses. So we're looking forward to hear what you all have to share. And so today we will be somewhat dissecting some of the common mental illnesses. And to start on our list today is depression. So please tell us exactly what is depression? How do we characterize depression? Ms. Reeves, we could start with you.
Yeah,
Okay,
lady before gentleman.
thank you so much, Daniela. Depression, we can say it's a common mood disorder that impacts. The research have shown about 300 million individuals across the globe. And also, when you talk about across the globe, you're even talking about Canada and the rest. We have about 1 in 5 Canadians do have mental health issues. And 8% of that number also have issue with major depression. So depression is a very common phenomenon in our world that has a lot of mental and physical symptoms, but most importantly, it interferes greatly with our ability to function, to do those normal tasks that we normally do in our lives. And there are lots of factors that contribute to that. And some of those are whether environmental, whether physical, whether biological, or some other psychological factor that we say it happens as a result of some of the symptoms. We talked about severe sadness, hopelessness, a lot of inconveniences in life when it comes to overcoming simple situations and simple issues. It becomes very, very much overwhelming in our daily activities that we have to do because there's a lot of sadness. Individuals feel very sad, very empty, restless, very irritable, can easily get angry. And I will stop here and then you ask the other panelists.
Okay. Mr. Bowler, what do you have to add to that? What we know of depression?
Thank you so much. Depression, it's mostly focused on our moods, our feelings. Like Nancy said earlier on, it has the ability to interfere with your normal activities, how people would react normally and be energized. Depression will in the simplest form or term, will make you tired. It will make you not motivated to do anything. You have no pleasure to do anything, even to get up from your bed, a problem. To even turn the TV on, a problem, up to the extent that to even get up to take shower, to take care of yourself, to do your common daily activities, your livings, it'll be a problem. To even eat, it'll be a problem. You don't want to talk to nobody. You want to be by yourself. You don't want to interact with other people. It gets to the point where you just want to lock yourself out and just isolate yourself. Just be by yourself. Don't talk to nobody. Don't do anything. Don't get involved with anybody or anything at all. It gets to the point to where depression can also lead you to start having different thoughts. You feel like you're worthless. You feel sad for yourself. You feel hopeless. You feel as though nothing can work for you at all. You feel as though that I don't care what you do, it's not going to work. You just have that mindset. So at the end of the day, you don't even bother. You are not motivated to do anything. I think those are some of the definitions, the meaning, the signs, and the symptoms of depression.
Thank you. And Mr. Ja, so I know it's very commonplace today for someone to just say, I feel depressed, or, my mom passed, my dad passed, so I feel depressed today.
Mhm.
What is the difference between just a general sadness, feeling of sadness versus depression?
Good question. Yes, we all, mood is a natural thing. All of us have emotions. Um, that's a characteristics of life, but it becomes so anyone who doesn't even experience sadness is or happiness, if you can experience any of those things in life, then something is also wrong. So we have to experience them. But the clinical depression that we are talking about is beyond the ordinary sadness, the ordinary lack of appetite, the ordinary lack of interest in pleasure in things that, we are at some point you don't even want to play with your kids. Sometimes you are exhausted, you're tired, you don't want to get out of bed. These are regular human experiences. But if the sadness or the lack of interest, the lack of motivation goes beyond what is normally expected and it interferes with all of your with most of your functioning, then it becomes a concern. For there are some categories of depression, like for instance, if you have the major depressive disorder, um, which we will get into. Sometimes the sadness, the lack of interest, the fatigue, you can't even concentrate. There is a sense of guilt. You feel worthless. You don't even feel like living. Some people even have thoughts of killing themselves. If that exceed beyond like maybe 2 weeks, okay, and it's beyond even yes, if your parent, if your relative, close friend pass away, you lose a job, there is a sense of sadness. But in the absence of those things, or if it extends beyond weeks, for some, they don't even know the reason why they are sad, why they feel tired, exhausted, or they can't even sleep, they can't concentrate. Okay, if that goes beyond the expected time and it interferes with your work, with your relationships, with your personal care, has the result of feeling sad, you can't even take a shower, you can take a bath, though there is water, and you can't do any of those things. You can't go to work, then those things become of concern. It's beyond the ordinary sadness that all of us may experience. So,
Thank you. And Ms. Reese, do you have anything to add to that?
Well, I mean, a lot have been said. I hope that some others were sort of taking notes. by Steve and Dave. But sometimes our childhood experiences can lead into adulthood, and it becomes a very depressive situation. I've seen clients who parents, had this real authoritative sort of a parenting style, and we see it as nothing. We say, in Africa, we train children like this. In this part of the world, you don't say this to a child, one that, but we need to come to understanding that sometimes the way we discipline children or the things we say to children can have a severe impact on their lives and how they come to view the world. So again, that childhood experience can be a lead to depressive sort of disorder. I got a client now, and I can tell you, he's up to at 24 has his master's degree, and he is very depressed. He thinks very little of himself. Immigrant parents, the way he was disciplined, you know, has led to where he is. So even with this wonderful achievement, he thinks very little of himself, and he's at the point of taking his life. So that's part of the sort of psychological impact that it can have on individuals. So yeah, those are things that we need to take into consideration. And as Steve said, even the work situations where we find ourselves, in a very toxic environment or workplace, where we also have the fear of either being jobless or all these sort of situations, health issues, when individuals who diagnosed with chronic health conditions, take something like cancer and whatnot, they can lead to severe depressive situations.
And Mr. Ja also mentioned that there are many types of depression or different types of depression. Um, can you tell us about that, Mr. Ja?
Okay, yes. So they will be categorized on the basis of the duration. Like for instance, major depressive disorder is one. Okay. And it happens in major depressive disorder, as we said, most of the symptoms that we have talked about are present, but key among them will be the depressed mood. And there is something called also anhedonia, meaning the lack of pleasure in things that you used to have pleasure in, they no longer interest you. And that has to be at least, for by the DSM, for one to be diagnosed, they should have at least 5 of those symptoms. Okay. And you should have 5 of those symptoms, and it should last for at least 2 weeks. When you start experiencing those things, like the feeling of worthlessness, lack of sleep, or too much of sleeping, not having appetite, you lose weight, or you are gaining a lot of weight. When those conditions cannot be explained by medical reasons, and it is through medical evaluation. Okay. So for major depressive disorders, those symptoms must be present for like 2 weeks. If you're experiencing them, then it's likely that it may be major depressive disorder. And there is another one that we call the persistent depressive disorder. Okay, it may last, the mood may last for like 2 years. Okay. And at least those symptoms that we talked about, some of them like having poor appetite, can't sleep, you have low energy, you have no interest, you can't concentrate well, you are hopeless, and the individual has problem even focusing on reading on a sheet of paper. So if those symptoms, like, just you need to, if they persist for a long period of time, like up to 2 years, then that's another form of depression that they call the persistent depressive disorder, which they used to call dysthymia. So that's one, that's another type of depression. Okay. Low energy, lack of sleep, or too much of sleeping, poor appetite. You don't feel like eating even, and these are things that are really common in our community, and people think that, oh, the person is just faking, he's just lazy, he doesn't want to get out, he or she doesn't want to get out of bed, um, he doesn't want to work, and all of that. He's lazy, he's just sleeping. But it could be depression that is affecting that person as well. So these are key major types. And then when you go to the other form of mood disorder, which is like the bipolar, okay, but that's we will also discuss because it's a form of depression, and then it's a form of mania also, where you are either depressed or you are in a very manic stage. You're full of energy, and all of that is happening to you. Okay, so those are key types of depression, where you have the major depressive disorder, again, as I said, and then the dysthymia, which is the persistent or the pervasive depressive disorder, PDD. Okay.
And so, we know that if someone has the flu, let's say, for sure, they got infected by a virus, right? So we know the cause of the flu exactly.
Yeah.
In terms of depression, Mr. Bole, do we know where it comes from or where it stems from or any causes? Is there anything definitive we can say causes depression?
Well, thank you for that question. We have to zoom in different things when it comes to depression, because depression can start off from different things. Let's say from the environment. Let's say from it could be genetic as well. It could be biological. It could be cognitive as well. What am I trying to say? Let's say you grew up maybe in a home where um, you saw lots of violence, you saw lots of things that could contribute to that. That's an environmental factor that could contribute to your depression. Let's say someone who grew up in a home wherein parents saw their mom depressed, saw their pa depressed. Um, the pa not motivated to do anything. All you want to do just sit around and just don't do nothing at all. Don't get involved. Don't even want to go to work. It's not motivated to do anything. That could stem down. It could pass from one generation to another generation. But to say we can zoom in on just one factor that leads to depression, or to say, hey, just this one is the only cause of depression, then I would say that's not possible, because clinically speaking, there are a lot of different factors we have to take into consideration. Let's take for example, some women go into depression right after they give birth. They go into depression. It's called postpartum depression. Some people also go into depression and they stay there when they lost family members, loved ones that were close to them. All of these different factors have to be taken into consideration to determine, what is the cause for that depression. And I want to say this for us to be very, very clear. There are also biological factors, but something that is clear about the entire issue of depression is that it could vary based on your gender. It could vary based on your race as well. It could also vary based on the place that you come from, your upbringing, your culture. It could vary based on your situation. So these are different factors and different things that has to be taken into consideration very, very carefully in order to determine the factors that contribute to depression. We cannot restrict it to one factor or to just one incident at the time.
Thank you. And Ms. Reeves, you also touched on a cultural aspect in this discussion of mental illness. So it's very common for us to see someone depressed and give them the advice of, oh, we'll pray for you or pray away the depression. What is some advice you can give our audience members on how to interact with people who are possibly depressed in their family or friends? How can they interact with them sensitively, and what maybe advice can they give them if they exhibit some symptoms of
Well, thank you.
actual depression?
Thank you so much there. I would just like to mention one other very familiar one that is talked about here a lot in North America, and that is the seasonal affective disorder when it comes to depression. And you see a lot of that during the winter, where we have shorter day and longer nights. So by five, things are all dark. A lot of people go into depression around this time. But as I was sitting there thinking, I thought about the African context where we have rainy and dry seasons. Where during the rainy season you stay at home a lot, right? I mean, you're not out as much as when the sun is shining, where you're playing and doing other things. So that one other thing we have to look at. And then within the African context, we may not even be looking at that. Last week we had to talk a lot here about the cultural perception of mental illness. So when we have those sort of thoughts about mental illness, if even someone is low, like all the signs and symptoms that we talked about here, they wouldn't even recognize that because the thoughts and perception is absolutely different when it comes to even realizing that such a disease even exists. But what do you say when you notice all of these signs and symptoms that we've talked about here in a relative, in a friend, or even in yourself? Go to your doctor. Go and seek help. Especially as Dave said, if it's persistent, you feel so tired, you feel so hopeless, you just feel like life is just not going for you. Go and seek some help. Go and ask some questions. Go and speak to a professional person, whether it's counseling, whether it's seeing your doctor. But I would first say, go and see your doctor. And if anyone listening to this show knows someone going through this situation, direct them to see a doctor. I would recommend first see your doctor. Doctors are doing a lot of recommendation with respect to sending the patients over to see clinicians and counselors and mental health specialists and all of that. That's a best and first step, I would say. Go and see your doctor. How do you treat such a person? With courtesy, with kindness, especially if that person was not living life in that way and you suddenly seeing the change. Be kind and courteous to them and help them through it in as much as you can by referring them or directing them or telling them to see the doctor. I think that's important, that come across my mind for now, because you can try to treat them. You don't know what it is that is going on. You can diagnose them. And as I said last week, we, even as social workers, do diagnosis, clinical psychologists and psychiatrists that do diagnosis. But talk to that person to go and speak to the doctor.
Thank you.
Yeah.
And we have also other disorders to talk about, illnesses to talk about. Next on the list is anxiety disorder. And once again, just what is that difference between a normal anxious feeling and an actual anxiety disorder? Mr. Bole?
Well, from a clinical standpoint, where so anxiety and depression work together to work very closely. They're very closely related. So most of the times when you find anxiety, you will find depression to some extent, especially over a certain period of time. And also vice versa, when you find anxiety, you will find depression. So the difference here is that with anxiety, it's part of a normal feeling. So let's take, for example, if you were to do something that you have not done before or that you are not used to doing, let's say if I were to come on this show, it's a normal tendency for people to have some anxious mood from the beginning. It's okay. It is our body responding normally to either the environment or the unknown or so forth. But it becomes different when it interferes with your daily activities, when it prevents you from doing what you are expected to do as a human being normally, or when it affects your mood. So let's take, for example, if someone gets anxious because they saw someone that caused harm to them or that led them into trauma or pain or suffering, that is not normal. If someone would become anxious because of a certain situation that they cannot control, or it becomes more than something that they can bear, then that is a different level now. It needs to be treated, it needs to be addressed. And that's totally different from depression. So in as much that it is the opposite of depression and they work together, anxiety can cause people to do things that they're not supposed to do also. Let's take, for example, if someone drinks alcohol, maybe I'm not normally a outgoing person, but I drink alcohol, I start to act a certain way. That could also be a sign of anxiety. I'm anxious, so I'm reacting in a way that I would not normally react in my normal mood. Those are all factors that lead to anxiety and that contribute to anxiety. But most importantly, it's important for us to know, and for our audience to know today, that anxiety and depression work very closely together. But anxiety could also be fear as well. It could be demonstrated as panic. You panic about something. You're very afraid. You are terrified. All of these are factors that contribute to anxiety.
Thank you. And just as a child of Liberian immigrants, and having grown up with my grandmother and other relatives who had to escape the war, looking back at it now, I do feel like some of them had anxiety. Everything triggered a panic. The slightest of things would trigger a panic. So, Mr. Jack, can you explain how possibly something like the Civil War could trigger anxiety within our people?
Yes, I mean those as we said, social factors play a major part into all of those disorders, like the anxiety disorders or even the depressive disorders that we have discussed. Yes, they do play a part in that. And the key, what anxiety impacts is really our perception, is the way we think about situations, and the lack of predictability. That's one major factor that affects folks, because they are unable to predict what the circumstances they're going to find themselves in. Therefore, they have all of these perception about situation. Like for instance, culturally, we say, "Oh, this person is very shy." Okay, shyness can be a form of anxiety that is happening. So then, in relationship with the Civil War, what you would notice for the most part will be people suffering from some form of an anxiety, which is no longer considered an anxiety, because it has been established, like PTSD. You experience it. People are on the lookout. They are hyper vigilant. They can't sleep. They are reliving the experiences that they've gone through. Okay, that is a form of anxiety. That is PTSD. That is being manifested in their lives, that there is a lot of fear. They have some forgetfulness. Part of the reason why that happened also is the mind or our brain has a way to protect us human beings, because the harsh experiences that folks went through, if we were to retain all of those things in our memory, if we can remember all of them, how you think we're going to feel? How will we act if we can remember all of those things? So as the result, most of them, those experiences are repressed. They are repressed into memory or into their subconscious. But there comes a time where the person is exposed to that event or something that looks like it, something that looks at it, and then it triggers those kind of emotions again. And then it sets in kind of fear. Oh, what has happened to me in the world, the way I was abused, this thing is very similar to that. And those things are not really controlled by the individuals. It's our brain. Our body keeps the records. The brain keeps the records of the experience and has the result. Some kids, as you said, may react, or even not just kids, but people may react through being very over vigilant, being very over careful. They are frightened, they are startled easily, they forget easily, they are easily angry. Okay. So those could also be as the result of their experiences and of the war. Yeah.
Thank you. And Ms. Reeves, can you add to that if there are what are other triggers or causes of anxiety?
Very good example. Question. Because, sometimes in social work, we have something we call structuring. And that is when you can sit before a client and tell them that you have lived their experience. Like if I sat with a client and said, I was also a refugee. Sometimes I'm teaching and I say to students, we're talking about course in immigrant and refugee study. And I say, I was a refugee for 10 years in Accra, Ghana at the refugee camp. They just go like, oh, wow, miss, you were a refugee. It settles them. I have experienced anxiety. And I would tell you firsthand, it's some of the worst things you can experience in your life. There was this morning, I was having low pain in my knee because teaching that student for 3 hours, dear me, in a hard pair of shoes, and you're bluffing as a morning professor. And I came home with a problem in my knee, paining me. As foolish as I could be, I took 500 mg of aspirin with a cup of coffee. And in less than no time, I could feel like the blood was running up my head. Like I felt almost like my mouth was twisting. And that created that panic in me. And I can tell you that went on for months. The feeling of fear, the feeling of some sort of phobia. You get that feeling that something is happening. Everything that, as Steve and Dave said, everything that happens to you, you make it, like a wild guess. You panic, you get that sensation of like you've been choked, your heart palpitates. I mean, it is an awful feeling. But as they all said, it comes about from certain situation in the environment. Something may have happened to you, could be a diagnosis. For me, it was swallowing aspirin stupidly with coffee, right? And that went on for quite a while, and it really bothered me. And I would say to individuals, when you get a sad news or bad news, or something that caused you to palpitate, give you that heartbeat, it is something that you need to get to your doctor. And what I did was I went to my doctor, and explained the situation. I even went to a social worker who was a mental health specialist and explained the situation. Now, it's a hereditary component to anxiety. I'll tell you this, in the African context, though we don't diagnose this because again of our thoughts and perception, my mother seemed like had anxiety, right? So the fact that it seemed like I'm predisposed to it, but that was a wake-up call for me in North America. And I was able to get right on hand and get it treated. And even at now, I'm still careful at how I handle things, right? I have a sister now who is experiencing anxiety. She went to work in Liberia and was kind of between sleep and wake. A robe decided to enter the hospital, and her head was bowed down, and they all shouted. bro. And she just jumped off her sleep and had that palpitation. Never treated it. And you know what? It just went through her body. As I'm telling you now, when she said it to me with my experience, I said, that's it. But that was the link. Fortunately for me, I was able to grab hold of that in North America. For her in Liberia, where there's no one to diagnose it, something had to be done. And I can't tell you on the area what I did, but something was done and she's been helped. So these are things that we look at, even the phobia. What are we afraid of? Sometimes you sit with clients and they can't really tell you what specifically. It's just they are just afraid of a wild, wild, wild guess, right? And it becomes a real tough situation. And as I said, when you are experiencing those things, whether because something happened, go and see your doctor. It is very, very, very important because it can easily cut away your sleep. I did not sleep well for 6 good months. And I will sit on this show and tell you, I had to go to my doctor and I was giving sleeping pills for 2 months. And every 11:30, I just popped those pills in my mouth and I was going to sleep. Because other than that, I went to bed at 9 and I was up by 11. And I will not sleep till 4 in the morning. How was that existing? It was very tough. But had I not done something, I would have ended up in some mental health institution. So they believe that it's the white man's disease or it's a scientific thing that is not proven. I will sit here and tell you I am a typical Liberian, mother Vi, Pella, Bassa, and Vi, and mother Vi, father Pella, Bassa, and these things exist. When you experiencing it, go and seek help.
And then yeah. And to that, I'd like to add something more.
Yes. Go ahead.
Oh, okay, yes, and that, yeah, that's a very great point. You know, we come from a culture that shuns people like fear. You know, these are some languages that we usually, oh no, I'm fearless, you know, I'm brave. You know, fear is frowned upon in our society. If someone is afraid of something, we think that person is a weakling. Okay, why are you scared? Are you afraid? All of that. So our society frowns on that. Even to express it. Oh, I have some fear. I don't know. Or I'm afraid of that crowd. I think I don't have the guts to sit amongst them or to go among these people. That is frowned upon in our society. When someone feels hopeless, and you know, also our society is a very religious society as well. So there is a high degree of that hopefulness. You have to be hopeful. You pray yesterday. Daddy, why can I get rice? Sorry. Why are you hopeless? God is in control. Yes, it is true. Yes, we teach our children to be brave, to be strong, to be fearless. Okay, we can see that in all of our political interactions and all of that. I'm the fearless, the unshakable, the unshattering group. So as the result of those beliefs, people who experience some degree of fear or maybe lack of confidence, what do? They don't acknowledge it. They're not going to go to anybody and say, I don't know what's happening. I'm feeling sad. I'm hopeless. I don't think that I can measure up to other people. If you do that, you will be ostracized from society. And this is why I think these discussions are very important, that yes, someone can experience fear out of nowhere. Someone can experience worries out of nowhere. You may have all the money, the resources. You can be a faithful Christian. You can go to church every day and pray and still be hopeless. those things are it's possible because what? Our brain has chemicals. We have hormones in our bodies that are not fully balanced. You know, though there is no real, we don't know what causes mental illness, but there are some correlations. There are some things that we can point to. So those things are happening to people. But if we allow them to open up, if we allow them and we don't mock them for being afraid, for being, you know, for being nervous among people, you know, for being tired, for sleeping too much, if we don't blame them, if we don't call them lazy, eventually those people will be able to come out and tell their story, and hopefully they will get help. So that's the point I really want. Uh, like what Sister Professor Nancy also said, that's it takes courage for her to even acknowledge that. And I think through those kind of acknowledgement, people will begin to realize that yes, mental illness, emotional disturbances are not just confined to Western people. It's not white man's or white woman's disease. They do happen. We experience them in every society. I've had some relatives when I was growing up. My first cousin, he will be in his room all day. His head overgrew. He was so dirty. And all we attribute that to is that somebody wished him, okay? Or someone at the age of 18, 19, 20, this person began to talk out of his head. We said the man went to use book medicine. He went for book medicine, and as the result, he got crazy. Or somebody wishing. Yeah, it might be somebody wishing, but to some extent, that person who is sitting inside their room, not even getting outside, not taking showers, and then suddenly maybe they burst up with cries, or accusing other people of trying to wish them. It could be due to depression or to bipolar, to some degree, to some mental illness. So thanks, Sister Nancy, for that disclosure. Hopefully some of these things will make people to understand that yes, there is mental illness and it can affect every society, anybody, any culture.
Yes, thank you so much, Ms. Reeves, for being so transparent with our audience. If you're just joining, this is part 2 of our discussion on mental health, and today we are delving into different mental illnesses. We've discussed depression and anxiety disorder so far. I'll take a moment right now to read you all some of the comments from Facebook. Robert Bangita says, depression might also take away your all in life, leaving you hopeless. It's within such stage that a person starts to feel suicidal. UJ Daycare says, wonderful education. I hope Focus on Liberia will continue other topics that will benefit the country. Thank you for that. Marie Quest says, one trigger of anxiety could be a fear of failure. And Marie Quest also says that she strongly agrees with the speaker to see your provider or doctor with unusual feeling or change in health. And then we have Alex from our Focus on Liberia team. He says, wonderful topic. Thanks for bringing your expertise tonight. I was put on anxiety medication, diet, and exercise not too long ago. He's doing much better now. His question is, what are some natural remedies to deal with anxieties? Thanks for educating us, and please continue educating us. So any comments or any suggestions on natural remedies to deal with anxieties?
So what, national remedies?
Natural.
Oh, natural? Well, a disclaimer, we are not providing treatment here. We just discussing, and our goal here is not really to provide treatment. You have to go to your your psychologist, your doctor, your clinician, your psychiatrist, and all of those, or even your PCP. Some of them can provide some treatment. Um, but what we should also understand is that anxiety is a natural response to things in our environment. Okay, let's look back. If for those who, in, let's say evolution, or when our folk parents were in, our ancestors, when we didn't have cell phones, when we did not have protective devices like gun and all of that, and we have to interact with maybe animals, okay, when society was not that developed. So evolution or even God have a way of providing us some natural protection. And that protection comes in the form of fear. What happens if you don't have fear? Generally, if you don't have fear, you can walk into a moving train. You can walk in the middle of the night in a very dark place with people holding knives in their hands, even coming towards you. So these are natural responses: fear, worries. If you don't have worries, how do you pay your bills? If you don't have worries, how do you even go to work to find a means? So these are real. So anxiety itself is a natural response, just that sometimes it gets out of hand. And then it becomes so unreasonable that, oh, if I get in that public, they will laugh at me. Okay. So part of the things is that you have to sometimes go against your own fear, try it, go against that fear. Things that you are afraid of, things that you're worrying about, or sometimes you even think about it. Oh, what's the worst that's going to happen to me if I miss my bill? Or what's the worst that's going to happen to me if I walk in that crowd and somebody laughs? I'm not going to die. Okay. Balance your diet, eat. And I think Alex looks like a very fit person, so I assume that he's exercising. He's exercising as well. And then, hey, train your mind. There are a whole lot of things that you can do, but the most important thing is consult with your doctor, consult with specialists that know those things, and keep active. And then keep your social group. Get yourself connected to other people, to friends, to family members. Don't cut off speech for everybody. So that's those things can be very helpful as well. So that's all I can say on that for about some of the natural treatment that you don't need. If anything, I can do some referrals if people want.
Thank you.
Yeah.
And before we, I guess, lose too much time, I want to make sure we touch on the other illnesses on our list tonight. We also have bipolar disorder. So, Steve,
wow.
tell us, what is bipolar disorder?
Thank you there. Bipolar, that's one of the disorders I've noticed or I've heard us throwing around a lot. We throw it around for every little thing. If someone gets agitated, people say, "Oh, the person is bipolar." If someone gets mad or angry, say, "Oh, you're bipolar." The person gets irritated, we say, "Oh, this person is too bipolar." But let's, those are all myths and some conceptions that we have about every time we hear the name bipolar. So truly speaking, bipolar has to do with mood swings. It has to do with mood swings, but it also has to be attached to at least one of the most important part. It's not just mood swings, because if we just consider mood swings and say, because this person get mad today, so they're bipolar, or when the person was just talking about something and they were all quiet, they were all laid back, but then now they're all mad. You know, they have bipolar. It doesn't go in that way. It has to be attributed with manic episode that are involved also with depression. So let's take, for example, what that means is in terms of manic episodes, we have to the person has to say today I got mad. I got really, really mad right now. And then also I got excited maybe at the same time, or I got mad and I start talking to myself. Let's just say somebody get mad. We're having a conversation and I get mad, I turn my face on the other side, but then I start talking to myself for a very long period of time, or for over a certain amount of time. Or while I get mad and I start talking to myself, the next thing I start to do is I get in a depressed mood. I leave you guys. Those are signs of bipolar. It has to happen over a certain amount of time, over a period of time. We can't just wake up one day and say, this person got bipolar because they got mad today, or because we're talking and it just changed the mood. So I'm trying to make this as simple as possible so that our audience can understand when they see some of these symptoms exhibited by people. We don't just run into conclusion and just throw labels on people. We don't just say, hey, this person is bipolar, or this girl bipolar. You know, when people have misunderstanding, when couples have misunderstanding, especially among the young people who say, that girl, she bipolar, or this guy, he's bipolar because he got mad, or because we're having a misunderstanding, or the person got into a mood. At that point, we attribute them to bipolar. So bipolar is not just common. It's not just something that you just say is bipolar. And in our society and in our culture, for the most part, it has different attributes, different reasons. So it could stem from somebody being depressed for a very long time, over a very long period of time, you know, and so they start having these different mood swings as well. So bipolar is not just restricted to one sign or one symptom. It has to be the combination of more than one signs and symptom.
Thank you. And Ms. Reeves, what can you add to that discussion about bipolar disorder and actual differences between a general mood swing, legitimate mood swing, and, you know, a bipolar mood swing?
Well, thank you so much. I think Steve rightfully covered that very much. Bipolar falls under the mood disorder there, and it has to do with that state of euphoria where you see someone, you know, over a period of time, and the next time, they're going low, you know. I've seen a lot of clients with that. It's either high where they're really hyper, or they just go flat low, and just that sense of hopelessness, no interest in doing certain things in their life. And it's one of the two, and it's become very persistent. It's sort of a persistent depressive disorder that individuals experience. And I've also talked about that seasonal sadness that happens. So as Steve said, we can't just overly diagnose people as being bipolar. I hear a lot of that. Don't get me wrong. That I think that person is bipolar. The person will really be bipolar, but we cannot just, because he or she is your friend. And as you listen to this show, don't go around diagnosing people. When I get clients sitting before me and say, you know, I think my husband is bipolar. I said, who told you your husband is bipolar? Oh, well, his behavior, or my wife is. I said, stop saying that, because that's a medical diagnosis that has to be done either by a psychologist or a psychiatrist. But as Steve rightfully put it there, that has a lot to do with that state of euphoria, or that state of totally being down with respect to a person's mood. And there's a combination of those. We got major depression, of course, bipolar, persistent depressive disorder, where that Dave also talked about, associated with depression and those symptoms of being less interested in doing things in the person's life. But there was one thing I wanted to mention in anxiety. How many times have we come across friends or relatives who would wipe the table 3, 4, 5 times to make sure it's clean? Mm-hmm. Or would check the door 4 or 5 times to make sure it's locked? or they call themselves, the real phobia when it comes to germs and those sort of things. That is a part of what I wanted to touch on with respect to anxiety, what we call obsessive compulsive disorder, where individuals just never, they can work themselves out to make sure things are put in the right place when actually it's done. That was just that I wanted to mention with respect to anxiety. So they become really overly anxious that things are not done well. So they have to check it over and over. You see them washing a glass and they will wash it and wash it and wash it. And everything has to be sparkling clean, and they just overwork themselves. But back to bipolar disorder, as I said, Steve mentioned a lot about that, and he covered it very well with respect. But all I can say is from that state of euphoria to that state of just being really flat. So individuals can have both personalities or one. And I've seen a lot of clients with a very hyper one. Of course, as Steve said, we're not here to diagnose or prescribe or come up with medication or whatsoever it is. But of course, one thing that we do or use in our clinical practice has a lot to do with cognitive behavior therapy, where we help individuals to sort of refocus or rethink the way he or she perceives the world. As we talk about the word view, how do you perceive the world and things around you to help you sort of minimize that way of thinking? Of course, don't get me wrong, medication also comes in, but it's a combination of a lot of those things that really helps the individual.
Thank you. All right. And also, due to time, I want to make sure that we also touch on schizophrenia. That's another disorder that we want to touch on tonight before we end the show. Go ahead, Mr. Zhao.
Oh, no, yes. I mean, on the bipolar aspect, like just to add to what those beautiful presentations by my colleagues, yeah. Sometimes something we may not that we may not notice in bipolar. In the first place, bipolar, that is two poles, from one point to another. Either you depressed or he's in a manic stage. Okay, at that manic stage, the person has too much of energy. Sometimes they don't even sleep. They do things more than they. Sometimes you and that high. Some folks even enjoy it, that you can work 16 hours no rest. Okay, non-stop. That is during the manic stage, and this is not to say, I know a lot of Liberians that do doubles. Okay, that's not what I'm talking about. The manic stage of bipolar. Okay, that they work too much. That's different. But it becomes so unusual that there is too much of energy. As a result, the person is not sleeping and all of that. Okay, and if this lasts for like 2 weeks. But one other interesting thing that we also have to notice in bipolar, there is something they call grandiose, inflated self-esteem. Okay, there is a lot of grandiose thinking. So, and I like to emphasize these things because sometimes we see them happen in our community, in our society, where someone wakes up in the morning and says, I heard a voice from God. God spoke to me. I'm the prophet. I'm bigger than everything. So it can happen from that if you really start observing that person from that depressed state, and then suddenly the person maybe becomes so manic, they are energized. They have this inflated, we call that inflated self-esteem or grandiose thinking, grandiosity. Okay. Yeah, sometimes we think that they are prophets, they are people of God, they're hearing, they hearing God's voices and that. And so it's a feature of bipolar. Okay. This is not intended to discredit our prophets or people who think that they are God or the Pope I've seen, I read a story from Liberia, I think 2 years ago, about this guy going to one office, to a newspaper place, or to a radio station, saying that God talked to him that nobody should drink uh, wells. People should hold their water before 6 o'clock in the morning. Else, if they don't do it, they will be poisoned, or their children are going to die. And so sometimes those things may be the result of some grandiose thinking as well. When I was growing up, at some point in time, someone wakes up and says, I just heard a voice from God. All the children in this town, they should wear a key, a chain on their neck and all of that, because I got this message from God. Who knows? It could be some symptom of bipolar. Okay, so but again, those, some of them are culturally acceptable, but we should still also open our minds and our hearts and our ears to those kind of things that may happen. Why it is true, our culture may revere such people, but at the same time, it might be some signs or symptoms of some mental illness as well. Okay. Then, so we can go to our schizophrenia, as you have stated.
Okay. Yes, so let's move on to schizophrenia and exactly what it is. Steve, again, can you define that for us?
Thank you so much. In the context of schizophrenia, you will come to understand that this is not just a pronunciation alone. It's a problem because it's spelled weird, and so most times people who are, let me use the word, African descendants, don't really pay attention to schizophrenia, because schizophrenia is a total different disorder that's not really commonly talked about, like I said, in the everyday way of life or how people do things. But let's look at schizophrenia itself, in how it is defined, how it is looked at in a context, whether it's from a cultural perspective or it's from a religious perspective. Let's look at it. Schizophrenia in itself is a mood disorder as well. It comes under mood disorder, but it has to be chronic. That's critically important. Schizophrenia has to be chronic or severe. It either has to be chronic or severe. And one of the things too that it comes with is it comes with psychopathic symptoms. What does that mean? Because I need to break it down. I need to break it down for us to understand it. In other words, people who are schizophrenia or who are diagnosed with schizophrenia tends to not have reality in check. So let's take, for example, we will be sitting here, and while we are talking, someone tells you, "Oh, I see some men walking through that door. I see some people walking through the door. Oh, no, they're telling us to go. They're telling us to go. They're telling us to leave. Or we got to go hide ourselves. Or we got to go do this. Or we got to go do that." In other words, schizophrenia, people that are diagnosed with schizophrenia, they're not in touch with reality. Their reality is different from our reality. Let me put it that way, very simple. Their reality is different from our reality. So you and I will sit here and we'll act normal. No, they will act normal. You and I will sit here and we'll talk normal things. Maybe they might talk normal thing 1 or 2 times, but they will switch gears on us. They will change automatically and start saying something that don't make any sense. So let me revert a little bit to what Mr. Jai was saying earlier on with them not being real. Somebody will wake up and they say, we see that normally in Christendom, and I'm not trying to pick on any religion, but I'm just trying to relate it to some facts here that we need to look into as well. We see that normally in Christendom. Somebody will tell you, say, as we are sitting here, I see the angel of the Lord descending right now, and they are talking to me. But all of us there, we don't see the angel of the Lord. Only seeing the angel of the Lord, and the angel of the Lord is talking to you. Now, when you come to ask them what the angel of the Lord is saying to them, they will probably tell you something that don't make any sense to the general public, or that don't make sense to themselves. But that is their reality. In a nutshell, schizophrenia means those people are not in touch with reality. Their own reality is totally different from ours.
Thank you. And so I grew up in New York, and I did end up working with a nonprofit organization that helped homeless in New York City. And so a lot of the homeless there would be diagnosed with schizophrenia. And sometimes they seem to be a harm not only to themselves, but possibly to others. So, Ms. Reese, can you tell us basically the extent of schizophrenia and what that means for their loved ones and people around them?
You know what, honestly speaking, it's pretty tough. You know, of all of the mental illness we've talked about, schizophrenia is it's pretty troubling, and because it has not research have not really determined the cause of it. You know, you listen to a lot of people talk so many different things. I know in the context of Liberia, we talked about the usage of marijuana. You know, how you see young people or people who smoke marijuana are quick to go crazy on the street. But research in North America has shown that mostly between the ages of 15 to 25 experience a lot of schizophrenic episode. It's hereditary. We can inherit it from our parents. Unfortunately, in the African context, we don't diagnose it. We don't diagnose our parents, so we don't even know if we inherited it from our parents. But it comes with a lot of what we call hallucination, delusional thinking, as Steve said, and discussions of thoughtful disorders it comes with. And it's on the positive and negative. And when I was reading, the positive or the negative doesn't give anything really good, because on the line of the positive, there's a lot of delusion going on. On the line of the negative, you got a lot of withdrawals from society, not motivated, real inappropriate mood that they exhibit. And we see, you know, the people you see walking on the streets in Liberia, sometimes naked, sometimes half naked, hitting and slapping people. That is actual schizophrenic episode you see going on there. And it's unfortunate that we have no diagnostic to help these people. It will come from simple stress to depression and just end up in that ways, right? So then you look at some of the issues here that we looked at: lack of sleep, right? Or sleeping too much or not even sleeping. You know, when I told you about going to bed at 9 and getting up 11 and then don't go back to bed till around 4 in the morning, I'm telling you, when I woke up, when I stayed up to 4 a.m., I was never in my mind. I was trying to get my thoughts together, but not sleeping constantly for 2 months. In fact, I went for almost 8 months. That can lead to a schizophrenic behavior. So it's a real severe situation that we need to really treat. And we say, well, even though it's we predisposition to it, or we can inherit it from our parents, it can happen to anyone, any one of us. It can happen to. So we need to take those into serious consideration. Yeah, and you know, consistent low of energy, confusion that you experience, hearing verses, what Steve and Dennis and Jad talked, and Dave talked about. And I know, you know, Christians would start to slap on some of you there, because people, you know, in the Christian realm of thoughts, you know, say the Lord speaks to them. And the Aladura people in Liberia talked about prophecy and all of that. But again, to what extent? You know, someone, you know, come and say, Jesus is coming tomorrow. Well, the Bible says when Jesus comes, all eyes shall behold him, and we will see him in the clouds of glory. So you got people preparing on Christmas Day, selling all the things. I remember in the 90s when I was in Ghana, people literally sold all the things because they were told Jesus was coming, and they part up and went into a church, and it's where they had themselves because Jesus was coming, only that Jesus did not come, you know. So you wonder where people get those sort of delusional thoughts from with respect to that. But another situation here that I can think of is in gerontology, the older folks experience a lot of dementia. As part of that, they also do a lot of hallucination. So those are other signs and symptoms that we can look at. I don't know if I answered your question or I went running all day.
And when we talk about schizophrenia, what comes to mind also is the movie A Beautiful Mind, which chronicles the life of John Nash, very famous mathematician, brilliant mind, but yet he suffered from schizophrenia. So, Mr. Ja, can you please just give us a little bit of information how, you know, a diagnosis of a mental disorder doesn't mean that you would lead a life of failure or a life that is not fulfilling?
Yes, thank for that question also. In my practice, in my interaction with people, what I tell them, what I say is, your mental health challenge does not define you. It's just another facet of your life. It just constitutes a piece of your life. So I even in my practice, I don't like people saying, "Oh, I am schizophrenic." You know, I'm a bipolar person. No, you're not.
Well, do you know whether John?
Okay. It's just like you saying, I am a malaria. The malaria you have, or typhoid, whatever, is just a hitch in your life. It's just one small aspect of something that is impacting your life. So there are a gamut of other things that you can do. So you are not defined by a mental illness. And I also tell folks that if you have malaria, if you have diabetes, or if you have any disease, you will share that with your doctor. You will let them know about it. And after you take your medication, you are going to go to work. You're going to do other things. So mental illness should not define your entire life. It should not confine you to one place, because it's not your whole life. There are other things that you can get involved into. And I also like schizophrenia, has my colleagues have spoken about it. You can have a positive spin on that as well, because it has to do with some degree of creativity. Make people really creative. Hallucinations, okay? We said hallucinations can manifest in a lot of ways. It can be auditory hallucinations, like you're hearing things that other people don't hear. Visual hallucinations, you see things that other people do not see. They have like tactile hallucination. So what I sometimes tell people is, okay, who doesn't like to be imaginative and creative? So if you are imagining things and very creative, you have a kind of a unique perception of things. So what I would encourage you to do is to write it. Write those things that you experience, put them down or recall them, okay? That adds to your creativity. And at the same time, taking steps to minimize the symptoms, taking steps to minimize the way this impacts your life. And it should not confine you to just, okay, I'm going to wait, I'm going to take treatment until all these symptoms go away before I get into my own life. No, there is still a life for you to live. So mental illness should not define your entire life. It's just one little piece of that life. So delusions, yes, the delusions of reference, they will have like delusions of reference of persecution. And as you were talking about people who may be aggressive towards themselves or towards other people, because partly it may be due to that, those delusions of persecution. Hey, this person is about to hit me or to hurt me or to kill me. And before they kill me, I should be the first. I should be the one to get to them before they get to me. Okay. So those kind of things, but they go with some. There are some schizophrenic people diagnosed with schizophrenia that can be very creative. So it can be a positive spin that you can put on that. Very creative. There are some folks who write books, who wrote stories, who wrote movies, about their experiences with schizophrenia. So, as Professor Reeves was saying, also like early detection and then getting the help that is needed, and so there is a room for recovery. There is a room to improve the individual's quality of life, so that it doesn't become a death warrant that yes, my life is just stuck and is confined only to this illness that I have. But there are other things that you can get involved into so as to live a meaningful, functioning life.
Thank
I
you.
just want to say something, Danielle.
Yes, please go ahead.
And one thing, and I know I keep going back to this, that Dave have warned us here, but treatment are sore, but the use of alcohol and drugs, does that help the situation?
Mm-hmm.
So again, you ask a question, how can we be helpful to individuals with any of these situations? You can help them avoid alcohol and drugs or nicotine, especially those sort of things. It's very, very helpful because we know that alcohol causes some distortions of the cognitive abilities. And in the mind of this disease, using more alcohol doesn't really help. And the person could be taking alcohol again based on, ways to isolate themselves from society and others and thinking that could be helpful, but that is not helpful at all. It causes more problems.
Thank you. Thank you for that advice. And as we bring this to a close, this is Focus on Liberia. You all are Liberian. So with everything we've discussed, I would like to know, what are your thoughts and ideas on what can be done in Liberia right now to help people with these mental illnesses
on planet Earth,
even
and
with
we
our current
go
lack
about
of
doing
resources?
our job.
There's the lack of funding needed possibly for medication. There is the lack of psychiatrists, possibly trained professionals. What are your ideas on what can be done with what we have and the resources we have to help people suffering from mental illnesses? So anyone can start with that. Who wants to jump in?
Well, I would come in there and say, I like Dr. Phil's sort of analogy. He says, in order to help with a problem, you first have to acknowledge it. We first have to acknowledge, I'm sitting here, I'm a Liberian. There's nothing in what I'm saying. My accent sounds like I was born in North America. I'm a Liberian, Vai Pele Bassa, and I'm telling you that mental health is real. Any one of us can experience it at any time in our lives due to certain circumstances. It could be biological factor, it could be psychological factor, it could be environmental factor, and so forth. It exists, it's real, and we need to take it into consideration. The civil war in Liberia, and I'm sure our next series will focus a lot more on trauma and post-trauma disorder. The war in Liberia exposed Liberians to a lot of atrocities. You're talking about almost 1 million Liberians fled as refugees into the West African subregions. You talk about displacements. You talk about double displacements. You talking about, we were on a ship leaving from Liberia to Ghana. Those who first went on the first ship, the Tana River, we should have been about 12,000 in that ship. And the captain was so nice, he took about 17,000. And I literally, not only me, others, literally saw dead bodies being thrown into the Atlantic. By the time we got into Ghana, there were dead bodies all around. By the time we got onto Bujumbura refugee camp, they were building ground zero for more dead bodies. You can imagine the atrocities that people witness, the fear, the anxiety. As I said last week on this show, when I hear the sound of gun, I have seen what gun is capable of doing. So what we are bringing here is saying to the Liberian government, if you have not put things, the resources in place, please try to do something, because the situation that people experience, whether 14 years, 15 years, 20 years, is still lingering in the mind, and it can have an impact. And good enough, you have Liberians like myself, like Dave, like Steve, and me, and Randolph, and all of us here doing the best we can to educate ourselves and willing to help Liberia. It's up to you to call on us. Thank you.
Thank you. And Steve, what are your comments on
And
what Liberia can do to address these issues, even with our lack of resources?
I think
did
the
you say
first
Dave or Steve? Oh, okay, Steve.
Oh, Steve, sorry.
Okay, yeah.
I think the first step is we've already got the balls rolling here, and other people might have. The first step would be to create the avenue, create the environment, and I want to be very clear. This is a national issue. It is not a political issue. It's not restricted to a certain political party. It is a national issue. I think it is about time that our leaders start to sit on a table and have a serious conversation about this issue, wherein they can seek help not only from Liberians but from others, that they can collaborate to be able to address the issue of mental health. Because some of the mental health illnesses we talked about today, we see them that they are prevalent in our country. We see them that they're days-to-day activities that our people are dealing with, struggles and illnesses that our people are dealing with, especially the young population. So I would say the first step is we've got the ball rolling here, create awareness, which we already started to do here, and we are hoping to continue creating awareness. We will expect the government, we expect political leaders and other political parties to get on board, to get involved, and to spread the message, create wellness, and also, like I said earlier, seek help. You see, one of the things that happened when the war happened, and funds were allocated or there were donations made to Liberia in order to address some of the issues when it came to mental health, was the fact that you get people who do not understand the cultural, the ethnicity, and the religious perspective of our people, because you see the issue of mental health has a huge cultural, religious, and ethnicity component that has to be in place. Those factors have to come together for you to see results, for you to see the result you need or you want in your treatment. So I would say that we all need to get on board. We all need to get on board to push this. I would say let it be a national agenda, and let the government create an environment so that we can help our people. and they got to facilitate the process. They have to facilitate the process. And the reason I'm saying this is because like this president Donald Trump, or hate him or don't care about him or whatever it might be, one of the very first thing he did when he took over, and I will keep emphasizing on this, is he allocated money to address substance abuse, mental health, addiction issues in this country. Oh yes, he did. And so you will see that these things are tackled all around the place. State like Maine, when Maine was going all crazy, head scatter, because overdose and the drug addiction were going so high, they had to put method in place and strategy in place to attack it so that it does not affect the people. So I would say, in as much that we don't have the resources, we have the human being to do the work. We might not have the resources, we have the human being. We have Liberians who are knowledgeable. They might not be us. Again, we don't have to make this about a party issue. It has to be something that we care, that we want to do, to not only preserve the future, but to save the republic. Because majority of the young men and women that are in Liberia right now that are titled with the name Zogos, or however you might want to call them, on a daily basis, you will see that the numbers are increasing in the country. So this is an urgent call. It must happen now, effectively, immediately, so that we can preserve the future. I will say again, to focus on Liberia. Thanks for the opportunity that we can continue to have this conversation, and to other platforms, other media outlet, other social media outlet. Let's continue to do this. Let's continue to educate our people. Let's pass the information on. Let's create the awareness as much as we can. Thank you.
Thank you so much, Mr. Bullet. And Mr. Ja, what is your answer to what we can do right now to help people in Liberia suffering?
Thank you. I think we have started already. Awareness is key, you know. So what we are doing, as little as it may be, is a good start. As someone said, you may not change an entire community, you may not change the world, you may not change a nation, but when that effort begins with even one person, if one person is impacted, that person can go to the next and impact another person. So awareness is key. That's one. And we have to come up with the information on a regular basis as to the impact of mental health, or mental illness on any society. It doesn't matter where you are, it impacts you. And to make it even more relevant is that you don't have to be stuck naked in the street. You don't have to have delusions. You don't have to be chronically depressed before you have a problem. Just the daily stress, the thoughts of feeding your family, the problem of interacting with other people, the issue of force making, how do we build relationships? Today, I was listening to someone told me that a football game, which was viewed or has the counter meet, which they said is to build national unity, cohesiveness. I learned one of the teams in the process of the game walked out of the field. Okay. How do we use this kind of events? How do we use these occasions to bring people together, to problem solve, to reason together? That it doesn't have to just be for chronically mentally ill people, but how can we work together? How can we build consensus? How can we improve the lives of other people? How can I impact the life of another person? So when we begin to look at these things, not just as on an individual level, but on a national level, that what happens to John, what happens to Flomo, what happens to Yakwaulo or Nambwe affects Nambwe's brother, sister, and then his brother and sister has friends and relatives. So if we look at things in that way, then what impacts one person will impact 2, 3, 4, and then a larger community. So we have a responsibility to one another. If we begin to look at things on that level, that will help us create some awareness. It will help us create that sense of national cohesiveness. If there is a mental illness in a family, that family is impacted negatively, but that family member also have friends in the community. They go to the school that we go to. They go to the church that we go to. So it's also impacting them. It's taking resources from them, those resources that could have been used for something else. Maybe the money that I would have spent to buy a cup of rice so that I can invite my friends, now I'm going to use it to treat another person. So whatever level, we may not be the ones directly affected, but indirectly it's impacting the entire nation. And what happens if the nation is affected? These are the people that we need to work. These are the people that we need to be babysitters. These are the people that we need to become accountants, to become bankers, to become doctors, and whatever you call it. So having those people, taking them away from the society, or they're not having the means of contributing to the growth of our society, is also what affecting our larger society. So government, stakeholders, other people should see it as a national problem, has something that is impacting all of us, not just those direct victims. Because a healthy nation, a mentally healthy nation, is a progressive nation, is a productive nation. So we need to work harder. We need to work harder. And in fact, you need a healthy mind before you think about any other thing. You can build all the infrastructures, you can build the roads, but if you don't have the people with the right sense of duty, within the right frame of mind, it's useless. People are going to destroy those things. Someone who is schizophrenic, he doesn't care. He will sit in that street and urinate on it or whatever. So this is a national crisis, and we all should get involved in that. I think we have started the discussion. To our audience, we might have overwhelmed you with a lot of information, but we are still around. Let us continue to discuss this, to take it seriously, and see how well we can mobilize resources far and near so as to be of help to our community and to our country, and even to our folks that are also in the United States here and in the industrialized countries. They may have some, or been impacted too by mental health. So thank you very much for this healthy discussion, and our doors are open that we should continue to dialogue.
Thank you. And thank you all for being here. Is there anything else that anyone would like to add before we close?
Yeah, Dana.
Yes.
Oh,
Go ahead, Ms. Reeves.
okay. I know you mentioned with the government not having the resources. I don't believe the government doesn't have the resources. As Dave said, where's the preference here? Infrastructure development, don't get me wrong, it creates jobs, it gets things going, it opens up the country, it increases tourism. It's great to develop the country, but you can't develop a country when the minds of the people are not developed. And I always go back and say, with the situation of Liberia being a post-war country, there exists a lot of mental health issues, right? So the government, I think we are not asking the government. I think we need to start asking the government. Maybe Dave, Steve, and myself and me, and we all need to get together and fly down to Monrovia and probably go up there and talk to the government. Maybe we need to take the initiative, right? And do something about it. So I don't want to believe the resources are not there. I think we need to step up the plate and go in and say, this is what we can offer. And that's what I said on behalf of the Town Association in Americas, NECTA, and FLAG, the Federation of Liberian Association in Canada. I will be, by the grace of God, in Liberia between May to August of this year, running some mental health workshop and anger management, co-parenting, gender-based violence, as much as we can. I will be there doing that. And I will be calling on people in the government to say, I'm here, please work along with me. Thank you.
Thank you. And
What-
Steve, you had something?
Yes, I have a quick announcement to make. I have two announcements. One for next week. What our audiences can look forward to next week. We will be talking about trauma. We will encourage you to invite someone, share the link, share the message. We'll be here about the same time today. So next Sunday we will be here again. Please invite someone. Let's talk about some of what trauma is. Let's learn from one another. Let's share with one another. We'll be discussing the different types of trauma. We might not cover everything. We'll overview it. And then the following week, we will pick up to go a little bit in depth so that you can understand why people act the way they act at a certain times. You also get to understand why you see young people get backpack on the back and they're jumping around behind other people and singing, different songs like I know Yama, and some of them are singing Your Militants Are Here. Your militants are here, you will come to understand why they're acting the way they're acting pretty much. But then you also come to understand, hopefully after we've talked about trauma, you also come to understand why is it people in government act the way they act too? Why is it civilians act the way they act, So we'll talk about some of these different things, but it's important that, we come together and discuss these things, and we welcome ideas. Another announcement is we will be in Maryland, the Maryland and DC area, come the 14th of March. That weekend, we'll be there for the All Liberian Diaspora Conference. I will be there. Grace of God, I will be there. Other members here will be there as well. We are sending an open invitation to all of you guys to please show up. Let's have some discussion. These are some of the things we're going to be talking about to address some of the mental health issues we have in Liberia, to address the addiction, and also to address the substance abuse. And because some of these things will lead to rape, like you are hearing. Just a typical example this week, I listened to a tape from Liberia. I listened to the tape. It was very disturbing. It was disturbing that the police, the police who should be preventing prostitution or standing against it or speaking against it, because prostitution in our country, as far as I'm concerned, is not legalized. I'm not stand to be corrected. The police were the ones involved in prostitution, and you can hear them talking about it. It tells you the mindset of the people and the nation at large. So come, let's talk about some of these things. Regardless of your political party or your political affiliation, it does not make a difference. Let's talk for once as Liberians, and let's have a good time. Again, thanks to Focus on Liberia family. Thanks for the invite, and we'll make ourselves available to be around to do these conversations and other conversations that you feel that we fit to do as well. Thank you so much.
Thank you so much, Mr. Bole. And again, thank you to all of our guests, Nancy Reeves, Steve Bole, Dave Job. Thank you for sharing your wealth of knowledge with us. As Steve explained, next week will be part 3 to the series, and it will be mental health in relation to the Civil War in Liberia, and speaking specifically about trauma and then illnesses along those lines. So thank you to our audience. Please subscribe to our YouTube channel, Focus on Liberia. We'll be here again next Sunday at 6 p.m. Eastern Time. Thank you.
Thank you. Goodbye. It was a pleasure.
Thank you.